and communication technologies can help accelerate progress towards every single one of the 17 United Nations Sustainable Development Goals, the SDGs. Information and communication technologies applied to health and healthcare system can increase their efficiency, improve people's quality of life. PAHO, WHO, is implementing an initiative for strengthening regional, sub-regional, and country capacity for information. System for Health. The project goals is to implement better decision and policy-making mechanisms in member countries through effective health systems that ensure universal, free, and open data and strategic information using the most cost-effective ICT tools. The COVID-19 pandemic has impacted directly on the population's health, but also on the disruption in the delivery of essential health service that remains through the region of the Americas. The impact of COVID is evident in the set of interventions linked to reproductive health, pregnant health, newborns, and children. On average, in the majority of the countries in the America, more or less 40% reported important disruption in the delivery of reproductive, maternal, neonatal health service in 2021. In the last years, this figure, more than 40%, that essential service not working is very important challenge. National Digital Health Record and Information System, telehealth, mHealth, and early learning tools are increasingly available, but unfortunately, they show very low rates of implementation. Taking more advantage of their possibilities will continue to addressing better results, not only on improving health, but also reducing inequities. Key intervention aimed at reducing inequities, improving accessibility and quality of reproductive, maternal, and perinatal health, and reducing inequities needed to be reinforced and strengthened. Strengthening access to evidence-based scientific knowledge in a timely manner for health teams, family members, and caregivers is a priority strategy for PAHO. The design of the application that we present today now is a demonstration of this. eHealth covers the interaction between patient and healthcare providers, institution-to-institution transmission of data, and peer-to-peer communication between patients and or health professionals. The application developed by PAHO, particularly in the commemoration of 120 years of PAHO, result in important support for the information provided through the application. The institutional prestige and the solidity of the information based on evidence, it is an important support for the users and innovation to with PAHO contributes. We really hope you can enjoy this meeting and learn about the application and make the download. It's of course free, and use it as. We hope to receive your suggestions, your opinion about the use of this, and maybe you can improve every day more this application for the health of the neonatal population in our region. Thanks so much. The floor is yours, Pablo.
Thank you very much, Dr. Cerulla. And now, based on this introduction, we are going to start presenting the application. So let me upload the presentation. Okay, so can you see the PowerPoint presentation?
Yes, we can see it. Thank you.
Okay, thank you. And I am going to introduce also Dr. Paula Otero from Hospital Italiano de Buenos Aires, who will share with me this presentation. And the idea of this presentation is to share with you some background and thoughts regarding the development and characteristics of the eCBB. eCBB, the newborn health application developed by CLAP and PAHO, is supported on the perspective of newborn health and rights. We know that based on the child's rights, we support the rights of life, survival, and development for every child, the right for having an identity, to be protected from violence, abuse, and neglected, to provide the education that enables those children to fulfill their potential, and mostly those who are small and sick to be raised by having a relationship with their parents and staying together with them, and for the parents to receive assistance and support in order to provide quality and responsive care, and to the enjoyment of the highest attainable standards of health, and that health facilities provide the adequate and timely care. But we all know that based on the inequities that have been mentioned by Dr. Cerulla, and that the pandemic implied having difficulties on accessing adequate care, it's an important challenge to improve newborn health and to protect rights. WHO and PAHO, in terms of providing quality of care, promotes the implementation of this care, quality of care, based on two main pillars: the provision of care, which is related to providing evidence-based practices for routine care and management of common and frequent illnesses, to promote actionable information system in order to have timely information for decision making, and providing or promoting functioning referral systems. But the second pillar is related to the experience of care. And regarding that pillar, the effective communication and meaningful participation of families, parents, and primary care providers, the respect, protection, and fulfillment of newborn rights, and the preservation of their dignity, and the emotional, psychosocial, and developmental support are or is equally important as the provision of evidence-based care. But for that, we assure that the competent, motivated, empathetic, multidisciplinary human resources are available to provide and to making sure the provision of care and the experience of care in order to reach the health outcomes that are expected. Based on that, and due to the increasing development of information and communication technologies, some years before, in 2020, CLAP, along with colleagues from the Hospital Italiano de Buenos Aires, developed this review about the information and communication technologies in newborn health. We intended to identify the scientific evidence about the use and the results of implementing information and communication technologies in order to improve neonatal health. This analysis, this review was developed prior to the outbreak and the pandemic of COVID-19. And we all know that during these 2 years of pandemic, we recognized and we realized that the importance of the use of technology and information and communication technologies were even more important in terms of contribute on accessing the families, the patients, the newborns, and providing adequate and timely information regarding care, health. And this is why we move on developing a digital tool aimed at improving the quality of care with the participation of family members and health teams. So the idea of putting in the center the family and the healthcare providers is the first objective of this enterprise. The strengthening and articulating the families and health teams also it's a second objective. And the third one is to generate an essential tool to reduce the impact of COVID-19 during the pandemic, but we are sure that this will be important also after the pandemic. And finally, to provide an application aimed at family members and healthcare providers about newborn care that will contribute to improve perinatal outcomes, families and parents' knowledge and skills in order to provide the adequate, timely, and nurturing care, not only within the pandemic of COVID-19, but also during the post-pandemic period. So this is why now I'm going to invite our colleague, Paulo Otero, to present and share with you the conceptual design and the process that during the development and testing the eCBB, we work together. So please, Paula, the floor is yours.
Thank you, Paulo, and thank you, Susan, for the invitation to be part of this launch, because for us, it was a great pleasure to work with you in the development of this application. From Hospital Italiano, we have been working on health information systems for the last 20 years. And for the last 10 years, we have been a collaborating center for PAHO. So when we saw the opportunity to work together in developing this, we thought it was an excellent idea, and all the things that Susana and Pablo had said, we totally agree with them. So next slide, please. We thought that the application had to be designed based on the not new, but current technologies that is use-centered, where we have to define, based on a survey, the target population, then test what we are planning to do, depending on the settings, and based on that, start working on the design. This is an iterative process that has to continue, and is what we are doing with all the different versions that eCBB is going to have. Next, please. So the first part was to identify the total population. And for that, we need a sample. And that sample, next, please, was to identify a target population in order to, next, finally get to the end users. So As Pablo said, we were working on an application that was used for the healthcare team, but also that we upgrade application for all who take care of babies. Next, please. So we conducted an online survey based on 10 questions, mainly oriented to 2 profiles, caregivers and professionals. And we got a total of 122 answers that, next please, showed us that most of the, nearly 80% of the persons that were surveyed said that they would either perhaps or would download the app. So we realized that there was a need for this kind of apps. So we started working on that. Next, please. So the next step was to work on use cases where we have to focus on the who, the why, the what, the where, and the when. That meant that we had to think that the population that was oriented was, as I said before, the health team and the caregiver of taking care of babies. Then what was why there was a need? Because there was a need to learn about diagnosis or symptoms. And when this occurs, there's a need to seek information. So that was the why. The what was how we would provide that information. And we would provide text, image, videos, and audios. And that was the great thing of doing an app, that you could use all the multimedia stuff that was about, and it was something the message gets better in a multimedia way. Where we thought they had to be mobile. So the person that will use the app could use it at work, at home, while traveling, or while was consulting. So there had to be a handheld device so that people could consult the information whenever they feel like it. And when we have to address all the periods from prenatal to the full first month in order to provide the information that would incorporate the whole neonatology period. Next, please. So based on that, we started with the design. This was a design that we tested not only with the users, but also with our sponsors and with the people from clubs. The idea behind all this application. And then we had the final application that is available, not only for iOS, but also for all related to Google. Next, please. So one of the things that was difficult was to choose a name that would be not only for English, but also for Spanish. So from the e-health care to babies, e-salud, cuidando a nuestro bebé, that came the opportunity to call it eCBabies, eCBB, or eCBB that was in Spanish. So the motto was greatly appreciated, and we think there's going to be a trademark for all the applications to come after this one. Next, please. So here you can see that you can download the application from both platforms, and there's freely available, and then Pablo will continue on that. But just to show you, next please, a little bit of what is available, we thought of an application that would be really easy to work with and easy to navigate. So we have all 4 big categories that you can see there, and then the categories have all the information. When there's information that is outside the application, we just provide a link so that the person could visit it. In that way, we thought that the application would be easily available for anyone who has a smartphone, no matter how much of storage space they have, because we think it has to be a light application that simply provides short, concise information. And if you want to expand about that, you can just visit the link. So if you have a connection that is not too fast, you still might have some information and no one is left out. So now, after presenting this, I leave you with Pablo, that he will speak about the future directions of the app.
Thank you, Paula. And yes, regarding the future directions, as Paula mentioned, the application is now available in English and Spanish. We work permanently on updating and uploading new content based on what is developed, and the source of information that we share through the app is mainly the evidence provided by WHO and PAHO mainly. So based on that, we try to facilitate the accessibility to evidence-based information that is provided and developed by WHO and PAHO. But we are working, and it will be soon available, also the version in French and Portuguese, so we can promote the use of the app along the different languages, the official languages in our region. We are also working with the colleagues from Ospedale Italiano in order to include reminders or prompts that will help and provide the reminder to access new and key material that will be included in the app, so you can access this information. This will be related to specific commemorative days like the prematurity day or the breastfeeding week, etc., and also important information regarding specific topics and activities. Another important direction we want to work on is strengthening the use, the dissemination, and the evaluation of this tool. And this is why it's important for the use and dissemination of the tool that you learn, you can download and use and invite colleagues, families, etc., to use the application. And obviously to provide inputs and comments that after testing and using the app, you can share with us. You can see here some statistics and metrics up to yesterday about the number of downloads and interactions with, from parents and healthcare providers with the app. By now, we can add in the Apple Store and Google Play statistics that more than 5,000 interactions and downloads were registered in these two platforms. We can also see the countries from where the downloads were done. And we hope that after this seminar, you can also download and your countries will appear in here, will be listed here in the statistics. It is important that you can see this peak and also the peak at the beginning represent the day that we launch this app in Spanish. So we are sure that today, tomorrow, and the coming days, these numbers will increase. And we invite you to disseminate within, as I said, families, students, interns, and colleagues. We believe that this will be an important tool to be recommended and suggested to mothers and families during prenatal care, around the delivery, and at every postnatal visit in order to take advantage of the information. Here you have the two QR codes. So you taking a picture of the codes based on the mobile phone you use, using Apple or Google Play, you can download the eCBB immediately in your cell phone. So again, thank you very much, and we invite you to disseminate and to use this app, and we expect that this will contribute on improving knowledge, skills, and mainly to improve the health and well-being of newborns in your country. So thank you very much. And if you have any comment we can have some few minutes for receiving your comments in the chat and interacting with you. If I don't see any comment, you will find also in the app a link to ask questions or comments that will be answered by us. So if you have any comment or recommendation on the app, also we will be happy to answer your questions. If there's no comments, so we will say thank you again to all of you. Thank you, Dr. Soruya. Thank you, Dr. Otero. Thank you, Ana Artigas and Roberto Porro, for your support on this session. And we will finish this.
Pablo?
Yes.
Let me thank you, that is the leader of this initiative and the father of this idea. I hope that everyone is able to download the application and also send this. We send for you after this meeting the record of this meeting, so you can disseminate this. Also, you have a lot of materials that you can use to disseminate for another people, for the Minister of Health, for the universities, for the professionals association. So it's very important. We did big efforts to do this, and let me thank you especially to Hospital Italiano and to Paula, that are amazing partners in this process. So all of this is for the implementation in the countries. As you know, those tools that we prepare is for you in each country. So I see that you have some in the participants. We have Darlene, we are also Solange and Itzel. So I really want that you are responsible for disseminating this and make that this tool can be used in each country. So let us know your opinion. We're very open. We really hope to hear about if it's good, it's not good. You can improve this and this. As Pablo said, we work on this every day. So you want to have the best application that you can prepare. So thanks so much for all of you, or for our team of club. And the floor is yours, Pablo, now again.
Thank you, Susanna.
Finish.
As you know, newborn health is a key priority in our region. And this is why we started this year with a communication campaign in order to increase the awareness and strengthening policies and activities and interventions regarding newborn health. So we would like to finish this webinar with a video that we invite you to stay until the end of this video with some testimonies and comments from families and parents from our region. Some of them obviously are from the English Caribbean countries, and you will listen the audio in Spanish, but the interpretation in Spanish. So thank you very much again. We invite you to use and disseminate eCBB, and we invite you to stay and enjoy the video with these testimonies and continue working on newborn health in our region and in each of your countries and institutions where you work. Thank you very much and have a great day.
Thank you. Bye-bye. Have a nice day. Bye-bye.
y una vez me habían dicho que el amor se multiplica, y es así. Es muy impresionante la sensación del amor profundo, como te atraviesa.
Dos bebés, doble cuidado, por ejemplo con el tema de la alimentación, tengo que anotar cuánto le di, cuándo le di, también pendiente de las vitaminas que hay que darle, o la curación del ombligo durante los primeros 10 días.
Pues para cuidar a la recién nacida yo le di su tetica y pues así como le mira esta gordita y hasta el momento sigue tomando lactando su leche materna.
Lahnaneu y Ischel y arre van significar juntir chue y cher la familia, chaque también arre ya una oportunidad che ojo hunan uta y ruk arre chakrakoi oh su uk y shik hunakal.
She was born premature. We saw the immediate benefits of breast milk. She had no infections. There were no complications. She was able to come home with us.
Borja, mi bebé, llega a una familia monoparental, pero con muchos primos, muchos tíos, muchos abuelos amorosos que estaban deseosos de que llegara y no se encuentran palabras para algo tan inmenso.
Nos dio COVID a mí y a mi mujer, pero había que estar al pie del cañón y levantarse de la cama con 39 de fiebre. Lo que a mí me demostró el nacimiento de Martina en el contexto es que el amor por una niña genera fuerzas infinitas.
Foi o dia mais feliz da minha vida, mas também foi o dia mais preocupante da minha vida. Eu tive vários cuidados em relação à pandemia. Eu só permitia visitas a pessoas mais próximas mesmo da família.
Desde que llegó Lucas me cambió la vida para algo muchísimo mejor, me enseñó a luchar más por todos mis sueños. La verdad que yo llamo la maternidad como algo, una experiencia caóticamente hermosa, algo que te cambia pero es para mejor siempre.
Pues sí, qué manera él pueda crecer más sano, de una manera que nada le afecte, pero creo que lo voy a ir aprendiendo poco a poco.
Fue como una nueva oportunidad que nos daba la vida para dar y para recibir amor. Ese motor nos llevaba a seguir formándonos para hacerlo bien.
No tenía leche al principio, ¿no? Y cuando ya empecé a tener la leche, pues el bebé, como era prematuro y chiquito, no tenía fuerza para succionar. Hasta que al 5.º día empezó pues a agarrar un pecho y al 10.º día el otro pecho, que eso ya fue un alivio para mí.
Como que el cuidado más importante que he tenido es traspasarle toda la tranquilidad y el amor del mundo. Mudarla, hacerle cariño, darle comida, preocuparme de que su piel esté suavecita, pero principalmente de darle amor.